Hello, my name is Michał Różański. I'm product manager in Ambient System. The company is situated in Poland. This webinar is the topic of this webinar. It's IP intercoms in the hospital or healthcare environment. Before we start again, I will inform you that this webinar is recorded. After this webinar, you will receive the PDF file with this presentation. And if you have any questions regarding this webinar, during this webinar, please write them in the chat and I will answer those questions after the webinar without any problems. So if we are clear, let's talk about agenda. As I said, we will talk about the hospital or healthcare environment IP intercoms, and we will answer some questions. We will answer the questions why to use the SIP intercom system in general. We answer the question how SIP intercom system can improve the the safety in the healthcare environment, and how SIP intercoms from how it looks like in the SIP environment in Ambient System portfolio. The Ambient System. Well, maybe for some of you guys, this company is already known, but for all the rest, we were founded in 1989. And that means we have over 50 years of experience regarding the voice evacuation systems. That's how we started, the sounds and fire and security systems. We already done over 10,000 projects across Europe, Middle East, South Asia, and other parts of the world. The thing that we are trying to build as a professional support for our customer. It's reliable on our own systems that we are sure it's going to last long beyond the warranty and other official declarations. As a natural path of growth, a few years ago, we decided to extend our one-way communication to version of two-way communication, to extend the possibility of providing the support of the information during the safety risks events, not only during the fire events, but also any other types of the security risks. So we have this little introductions over. So let's answer the question why and where use the IP intercoms. And we start, of course, with the environment for the healthcare. We can distinguish several locations in the facilities like hospitals, like laboratories, some research facilities, and so on. We can divide them to three categories. Some kinds of isolation rooms. Those were very popular during COVID-19 outbreak. So every one of us, I believe, can imagine ourselves that it was a thing that back then. Operating theaters, that's common space, and laboratories. What's common to three of those rooms that's used for different purposes is that there is a limitation of usage of the natural way of communication, for example, because lack of possible interaction in the isolation room, or because you can't bring the smartphone into the theater room because of the hygiene issues. And of course, the laboratories, there might be a restriction regarding the data protection, and that's why using the dedicated ways of communication that exclude the forms that might involve the corruption of the data or leak of the data for those facilities is very important. So three of them are restricted by using of the standard communication. all of them require some additional features regarding the cleaning standards and upkeeping the screening hidden in those rooms, in those facilities, every after they are used. So that now we can talk about why to use IP intercoms. We have to decide what are the spaces that we want to use the IP intercoms. And now we can start, answer the question what the IP intercom system brings to the table regarding the safetyness and general maintenance of those facilities. So fast and reliable communications is the first thing and probably natural to talk about. When we have this system in facility, we are sure that the communication between the specific places inside this facility is ready to use and is stable because of the codecs that we can use, because of the standard of the protocols that we can use, and because of the hardware that is reliable and it can control its statuses and inform the maintenance of the system, some technicians of the system, that there is some kind of the problem even before this specific unit or the specific part of the system is needed to be used at that very moment. So we are given a time to act somehow. Allow to implement the advanced safety procedures. This is something that is very crucial regarding the big facilities with really big amount of people that might act spontaneously during the evacuations event. We really know how this works due to the manufacturing of the voice alarm systems, and we are very prepared for that. But adding a layer of additional information, two-way communication systems can prevent us from leaving behind some people with disabilities. For example, a person on a wheelchair that somehow stuck without any support, without any help from others, can communicate freely during any kind of the dangerous situation, or even if there is no dangerous situation in means of overall situations in the building. The reliable communication provides this, can provide the information directly to the correct person to bring the help just for this very person. So how to operate and to confirm the type of threat is also crucial because we know that our healthcare systems, at least in Poland, it's short on personnel, and if we can save them as much time as possible to solve the problems, to confirm or drop the problem from the task list without moving from their table or without scheduling some other important task. This is the play that we want to take part in because it's very important to provide this information and confirm the information accordingly to the information that the system can bring you, and with, for example, the visualization system and integrations that can go along, for example, with visuals from the CCTV system. So the question is, do you need the IP intercom system? And to answer is, well, if your system needs reliable communication with the sureness of usages in any condition, any environment, for example, noisy environment due to some kind of medical equipment, or environment in which there is a constantly changing the noise around, we can use IP intercoms equipped with the special algorithms that improves the speech intelligibility in both ways. For example, for noise reduction, that will cut off the noise in the transmission path of the reporting unit. That officer, security officer, or main nurse, or whoever clearly hear our voice without any problem to understand what the message is from our side. And on the other hand, the other way, automatic volume control. If we are in an environment in which there is a noise that's constantly changing, the system can automatically adapt to this environment, make sure that noise to signal ratio is above specific value to improve the intelligibility or to improve the hearness of the communicate that we are trying to listen. Those are just an examples, but let's go to another reason. Seamless integration. We are talking about the IP system, it's in their name, and that means we are using the common environment, common infrastructure, and of course we are also communicate with common used protocols, for example, for integration, like SNMP or REST API standard, and of course we can also use the SIP 2.0 communication protocol that is the base or core for the communication in the voice over IP world. That means we can integrate either with the different kind of the telecommunication systems, but also we can integrate with the platforms for visuals to integrate our system with the CCTV cameras, with the access control. It's not a problem, it's just a matter of the configuration, it's just a matter of using the correct standards, and it's not the matter of some kind of hardware adjustments. Well, we can use also intercoms for the access control. Of course, it's not the access control system as it speaks, but the single intercom unit equipped with the relays and additional features like local code or RFID card reader can surely be the part of the access control restriction of some kind of access to the specific places. For example, the hospital ward might be equipped with the intercom at the entrance to make sure that any visitors will be invaded by the personnel to the ward to make a control over what persons is inside and who's leaving the facility. Scalability, again, this is thanks to the common use IP standards and its overall environment. It's easy to extend the intercom system. It's easy to add additional units. If you are using the backbone network system of the facility to decrease the cost of the implementation, we just adding additional edge switch, and with the little bit of the configuration, we can surely add new devices in the different way, the different part of the building. Reliability and availability, that's what I talked already. It's the situation in which we know that the system is available always. And of course, there might be a situation in which the device is broken somehow, but the device needs to inform the system supervisor that it's some kind of malfunctions, and this supervisor need to react, for example, replacing the device or maybe fixing it. It doesn't matter. The thing is that the IP intercoms are equipped with the auto-diagnosis formulas that will inform the proper administrator about issues. Either this is an issue with the audio path in single device, or it's an issue with the connection to the server, or it's an issue to connection to other devices. All of them can be monitored, all of them can be reported, and given the time for the administrator to react before the system is already need to be used by, for example, the staff or the patients. Well, we can imagine ourselves few scenarios in which these intercoms will be very used. The first one is inside the hospital ward. something that I already mentioned before. So imagine ourselves that the patient is in the isolation room and he needs to contact his family. This family can be available in the facility, but it's also supporting the communication outside the facility without any problem. We know that during the pandemic of COVID-19, there was a bunch of situations in which people were put it apart of their family, and keeping them in contact with them, comfort them physically and mentally. So this is something that it's very important in that kind of scenario. Patient can call medical assistance. This is something also very common, especially near the beds for the patients. The patient can call the nurse, call the doctor, and inform them that there is something wrong with him, or whatever this situation is. We're giving the proper way to communicate between those two potential parties. The nurse can summon the specific doctor to attend the patient. By using the IP intercoms, it's not only the pre-recorded, pre-configured communication that is available. We can also select the specific number, or even we can change the selected buttons through a web server to make sure that only the correct personnel will be informed about the need of the support for this very situation. So this is something that nurse can use using, for example, their personal code, or, for example, the personal reader card. Access control, again, this is something that I already mentioned. We talked about the entrance of the ward, but we also can talk about the entrance of the isolation room. It doesn't matter. Audio monitoring, this is a function that is very important during the night shifts when the staff is even more limited. It's good to have a solution that will able to inform you what's going on inside the patient's rooms. For example, if someone will get a couch and the system will not, the system will automatically try to identify the problem and inform the nurse that there is this kind of the situation. And of course, the nurses can also use the system to listen what's going on inside the rooms. Of course, all of the above need to be restricted and not used for eavesdropping, but we are giving such a way and proper way to secure this kind of activities and identify the user who tried to listen. Operation theaters, that's another environment in which standardly we have only one patient, but a bunch of doctors and nurses around. And we can imagine ourselves that the staff needs to be improved or needs to be changed somehow. So without going outside the hygiene sterilized room of the operation theater, we can call someone from the outside to come in and support us or replace us, whatever it is. We are giving the way of the communication to them. But also we can imagine ourselves that during this some kind of very hard operation procedure, there is a need for the additional consultation. And thanks to the usage of the IP intercoms, we are able to, for example, call outside the facility and bring the communication between two specialists to save the humans' lives. Of course, in such an environment, there is no way to use the mobile phones. There is no way to use any additional communication solutions. We rely on what we have and what is ready for be used within this kind of the environment. The algorithms that I already mentioned before are very important in this very situation, because the general medical equipment might be very noisy. There are some kind of pumps, there are some kind of devices to monitor this patient status. They are emitting the signals, emitting the working noises. all of them need to be suppressed, need to be detected and suppressed during the communication to make sure that two parties can communicate freely without any problems and with a hands-free solution. The device after the surgery need to be cleaned. That's why the device for such places need to be equipped with the special form of the layout at the front that's supporting the usage of the very harsh chemical agents that are used in this kind of environment. But the laboratories, this is a bit different. It might not. It's not limited only to the healthcare and laboratories. Of course, for example, here in Poland right now, we are working strongly on our national radiology institutes, and well, in such a places, the laboratories commonly used for detection some stuff, but also to discover a new one or creating science, to conducting science. They conducting the data, the information that might be not good to be published or leaked from those laboratories. That's why it's very common that the intercoms we are using, you use them there for the communication, because there is no way to use their personal solutions like for example the smartphones, because the smartphones can take much more data with them than just only the voice. Thanks to that, the IP intercom solution is also very usable over there. From other point of view, of course, there is also the need to keep those places clean, and the clean room type of the intercom, IP intercom, this is something that is very suitable for such places. And well, we can talk about how Ambient System is equipped to solve those problems or to provide the solutions for such places. As Ambient System, we have a whole portfolio of products that includes not only the intercoms themselves, but also the integration platform ISECOM, system gateway, and IPPBX server to manage and control the big numbers of the intercoms. It's ISECOM. Of course, including the voice alarm and additional supportive devices, we are able to create the fully configurable and enchanted communication systems, not only for the general mass announcement, but also for day-to-day communication and emergency events communication during the some kind of dangerous situation. So I will try to just give me a second. Okay, now you should see me, and let's talk about the core of the ambient system intercoms. We built our intercoms around one and single PCB. This very PCB is placed in every wall-mounted intercom of the ambient system portfolio. All of them are equipped the same, and let's go through this a little bit. The first thing that you might see is two Ethernet ports. Those Ethernet ports working as a switch, and also can work as inside the daisy chain system. So we can connect one device to another, to another, to another, up to 5 connections like that. Of course, there is no PEO connection one from another, but we can communicate. We can power up the locally through this 12 volts inputs. The other thing that we can see here is two relays that allow us to make the control over the, for example, entrance, some kind of passage, entrance the isolation room. and 6 general inputs, outputs. This is up to you what you like to use them for. You can program them through the web server. The whole thing can be programmed through the web server, and this is you deciding what they are going to do. There is a section for the audio inputs and outputs. We have a line inputs, line outputs, and microphone, headset for the audio and headset for the microphone as well. So there is like dual use. And for example, we can use line output linearly to the output of the speaker to connect the amplifier of the hearing loop to provide the additional feature, additional assistance to the people that might have some hearing losses and using the specialistic device to improve their listening skills. Each of the device is equipped with the RTC module. That means even if there is some kind of power outbreak and the system is not equipped with the UPS or other guarantee power source, after the power is up, everything should be communicated again without any problems, with proper dates, with upkeeping the this information and logging everything without any problems. Each of the PCB is also equipped with the mentioned algorithms. So it's noise reduction, it's automatic gain adjustment, and it's automatic volume control available on every device of the ambient system solution. We are using a wide range of the codecs from standard telecommunication codecs G722 and G711 to more advanced codecs for specific purposes, specific projects from SPIX to Opus. Each of the device is capable of communicate through the SIP 2.0 protocol, so we can connect even with the third-party systems. And of course, for the integration or monitoring purposes, we are using SIP 2, not SIP 2.0, SNMP 2C and REST API for additional integration between the systems. All of the intercoms and all of the servers can be configured through the web server, so there is no need to use any additional software from Ambient System to configure or manipulate with the entire solution. Additional thing that we are providing, it's clean room intercom. It's equipped with the PCB that already shown in previous moments, but the clean room intercom is equipped with the display and functional keypad. The keypad provides additional solutions. For example, we can adjust manually the volume control in the situation in which there is some kind of problem with the automatic volume control, and we can select, for example, by pressing FN and one of those numbers F1 to F4, we can press the fast pressing buttons to communicate with the correct person in no time. From the point of view of the display, we can use those arrows and we can select from the handbook the correct contact that we want to communicate with. And the whole thing is covered with the bacteria-proof foil that does not consist any holes in it. As you can see, there is no hole for microphone, there is no hole for the speaker. That's mean that the whole thing, the whole foil working as a membrane, and there is no risks that some kind of dirt or agents will get into the device and will contaminate them, for example, bacteriology or some kind of destructive way of the agents. Of course, for the clean room environment, we are suggesting to use the surface mount flash mount solution. This one is a surface mount, it's a wall mounted. But normally for theaters, operation theaters, for the isolation rooms, for the laboratories, the flash mounted solutions, it's dedicated. Okay, let's back to the presentation. All right. So where to use those stuff? As we already told ourselves that we can use the whole thing into the inside the operation theaters, inside the rooms for the patients present preparation before the surgical situation, or we can use them after that for the isolations to keep them controlled and to keep them in contact with other other personnel. Okay, here is the information about the eco clean room. Additional thing, at least in Poland, we already done the certification with our National Health Institute. It's PZH, and it's already certified product for the clean room environment on the Polish market. This is additional device, EcoStrong. It can be used for external purposes. For example, at the entrance, it's a wood-bust solution, AK10, IP67, so it can handle any conditions, environment conditions that you can meet. And it can be equipped with a keypad. It can be equipped with the fixed buttons, and it's also, as an option, can be equipped with the RFID module to keep the, for example, entrance safe and giving an access only to the right persons. EcoFrontier, this is a general purpose intercom, for example, can be used inside the hospital at the entrance of the ward. It's designed with the IP54, so it's rather the inside use than the outside one. And of course, all of those intercoms are equipped with the same PCB, so all of the above mentioned functionalities are available to each of them. As the desktop device, we're suggesting to use ACDG1, especially if you are planning to interact with the voice alarm as well, due to the large number of physical side buttons that can be programmed, in which we can make an integration between the voice alarm and intercom system much more smoothly and easily to understand by the personnel that will use this system. Of course, we have also the SIP speakers available in our portfolio. The thing is about those speakers that they are regular speakers from our portfolio for PAVA, T2550, W6 or S206. You can see on the screen there is a S at the end of each of them. That means the SIP. Each of them is equipped with the up to 50 watts amplifier, but they are limited. Of course, the 50 watts is available only for the horn speaker, and for the wall-mounted and ceiling-mount speakers, there is a 6 watt available due to the type of the speaker they are built on. Each of them can be communicated through the web server, configured through the web server. They can listen to the multicast, or they can communicate through the SIP 2.0. Little asterisk with that, we are not doing the fully IP-based with the IP-based speaker systems. They are more like actually auxiliary solution that can add additional feature to the areas without the voice alarm solution. And the system diagram, as you can see, the whole thing can be connected through the standard network switches. There is no problem with that. We can use any type of the configuration as long as we are keeping them in line with the with the configuration of the switches. So in this situation, we have something like multiple tree topology, but if we use different kind of switches, we can create the ring type of the topology, and we will use the switches as a edge one for this ring and connect to them the devices. It's up to you. It's up to projects. It's up to needs that are need to met with the system itself. The system gateway, as I said before, it's an integration platform. It's something that we can provide with the intercom system or with the voice alarm system. It allows you to use the intercoms, for example, ACDG1, but also the wall-mounted intercoms, to communicate, to distribute the messages from the voice alarm. So, for example, we can use ACDG1 IP desktop telephone to make live announcements through the specific floor to inform some doctor that needs to be available in the next 15 minutes somewhere. It doesn't matter. We can play pre-recorded messages. We can activate some inputs, activate some outputs. It's up to us. Of course, we are not able to use them during the fire event because it's not EN54 system, but for all other purposes, for all other security reasons, we can use this integration. The thing is that it's also good to mention that the web server of the system gateway allows also the user to upload the audio files, create the scheduled events, or changing the configuration of the speakers lines in the voice alarm. Of course, they are separate from the evacuation configuration. So you don't have to worry yourselves that your client, because you can give the access to this to your client, will mess something in the system gateway web server that might inflict somehow the evacuation procedure inside the voice alarm. No, they are clearly separate between each other. And during the evacuation event, during the activation of the fire detection system, the procedure of the evacuation for the EN54, by means of the EN54, will be secure and will be conducted without any problems. The whole thing on one scheme. In this situation, we are using the MIDIVES system, voice alarm system, in line with the system gateway and bunch of the intercoms solution, all of them for the normal communication, for the day-to-day communication, can be operated from the medical room with the SIP intercom unit. And during the fire alarm system, during the fire alarm event, the emergency microphone, the fireman microphone, takes charge and communicate with the voice alarm.